Okay. My name is Marina Franco with the Houston Recovery Center, and today we're going to be talking to Dr. Alicia Kowalchuk. Thank you so much for joining us, Dr. Kowalchuk.
Thanks for having me.
Dr. Kowalchuk, can you tell our viewers a little bit about yourself, your training, and what you do?
Sure. So again, I'm Alicia Kowalchuk, and I'm board certified in both addiction medicine and family medicine. And I work here with Baylor College of Medicine. Most of my work now is doing addiction medicine. Part of my role is at the Houston Recovery Center. I'm the medical director there. I also work through Baylor with Santa Maria Hostel, which is a drug treatment center for women on the northeast side of town. And I run their detoxification unit there. I also do a bit of work with Harris Health System and have a ambulatory addiction medicine clinic there.
Oh, wow. How long have you been working in this field?
For over 15 years, almost 20 years now.
Wow, okay. Why did you choose this field?
I got interested in addiction medicine during my medical school and residency training. I was in medical school and in residency around the time of the HIV/AIDS epidemic in the mid-1990s, and many of my patients were struggling with addictive issues as well. And we found that really to effectively address their HIV/AIDS and treat their HIV/AIDS disease, we also needed to address their addiction needs.
Wow. So what is the number one drug impacting our community right now?
Alcohol is actually the number one drug impacting Houston. Alcohol causes lots of years of life lost, illnesses, as well as from motor vehicle accidents and other traumatic incidents.
Okay. Can you tell me, what are your thoughts on healthy drinking limits?
So the healthy drinking limits are a good start for folks to know about to take care of their health, especially around their alcohol use. So for men under 65, the healthy drinking or low-risk drinking limit is no more than 4 drinks on one occasion and no more than 14 drinks in a week. For women and for men who are over 65, it's no more than 3 drinks on one occasion and no more than 7 drinks in a week. And of course, for pregnant women, anyone below the age of 21, the safest thing is not to drink at all. So there is no low-risk drinking limit.
Okay. Well, that leads to my next question. So do you think it's more effective to focus on abstaining from drinking rather than promoting healthy drinking limits?
I think it's not an either or. I think it's a yes and. It's a both. Okay. Certainly, newer research is leading us to the conclusion that any drinking promotes some health risk, especially a lot of cancers. There's some, although small, risk with any level of drinking. That's likely offsetting any health benefit from drinking that folks may have heard about, such as heart health and things like that. So our new understanding of the research is that the safest drinking limit is 0 for everyone. That said, drinking is still a big part of our culture here in the United States. It's a legal activity for adults. And so I think it's important for people to know, if they are going to drink, what's the amount of drinking and how can they drink in a way that minimizes their health risk.
Okay, so how will sticking to these guidelines help people, and what are some of the strategies to sticking to these guidelines, especially during this holiday season?
Yes, those are great questions. So sticking to the guidelines, really the guidelines were developed and those drinking limit cutoffs were set because data over multiple studies has shown going above those limits has significant impact from health. So going above 3 or 4 drinks on a given occasion dramatically increases your risk for having bad health effects, things like car crashes, falls, DUIs, etc., all these negative consequences from drinking. And over time, if you drink above the daily or the weekly limits, we see a substantial health impacts, things like liver disease and other chronic health problems come in. There are lots of strategies to help keep yourself within those healthy drinking limits. One really simple strategy is to just state your limits to yourself or to a loved one before you go out. So knowing what you expect and what you want to stay within your limits in terms of drinking for a given evening. That can be really helpful, and it can also be helpful if you realize you're consistently not able to stay within those limits. That usually means you may have a problem with your drinking, and it may have gone beyond just having a little too much to actually having a problem with an alcohol use disorder. So something like alcoholism, etc. And you may need professional help then if you're not able to set your own limits. There's some other strategies that are really common as well. One is to alternate drinking an alcoholic drink with a non-alcoholic beverage. Water is probably the best and the cheapest, actually. That kind of helps slow down your overall consumption for the night. It also keeps you well hydrated because alcohol is a mild diuretic, so it keeps your body hydrated. So those are two strategies. And a third strategy is to make sure you eat, either soon before or as you're drinking, because food in your stomach helps slow down your gut's absorption of alcohol. And so, helps from experiencing that hard, fast effect of drinking on an empty stomach. So those are all strategies to help you stay within your limits and to drink in a less risky way. I know many people are going to be hosting parties this holiday season and beyond, because we're coming up on big sporting events as well throughout the winter months. And so as a host, there's some other strategies to think about for your guests. So the number one strategy is to have non-alcoholic alternatives available for guests who don't want to drink. Maybe they're in recovery, maybe for personal and other reasons, they just choose not to drink at all. And then someone may be acting as the designated driver for several other people coming to your party. So it's important to be respectful of that and to have non-alcoholic options available. It's also your responsibility as a host, if you're serving, to monitor your guests for being over-intoxicated and help them make safer choices to get home at the end of the evening, particularly if they are visibly intoxicated. And when in doubt, it's better and it's safer to let someone crash on a couch, arrange for them to go home with a friend or family member, or call a rideshare service or a taxi, than to let them go out the door and be unsafe.
I agree, and those are all very, very great tips, so I appreciate that. Can you tell me what needs to happen to improve education on healthy drinking limits?
I think things like this video and the newsletter going out, a lot of people are surprised to learn that, one, there are low-risk drinking limits, and particularly surprised to learn what those are. So I think it's important to get the message out. Beyond just knowing the number limits, it's also important to recognize that those limits are based on a standard drink. A standard drink is a 12-ounce beer. It's a 5-ounce glass of wine, and there's about 5 glasses of wine in the average wine bottle. And it's one shot, or 1.5 ounces of 80 proof liquor. So it's important to understand a 40-ounce beer is substantially over the healthy drinking limit, our low-risk drinking limit for women, for example, in a given day. Whereas a 12-ounce beer and consuming just one of those would stay within those limits. So size counts, size matters. And it's important to understand that when you're trying to count your drinks and plan for a low-risk drinking event.
And what role can the medical profession play in addressing these issues?
So the U.S. Preventative Health Task Force guidelines recommend that all adults be screened in primary care settings at least annually for alcohol use and risky drinking. And the process is called SBIRT, or Screening Brief Intervention, and referral to treatment as needed. So making this a routine part of medical care is really essential to helping us address this issue in our society, and also helps eliminate the stigma that surrounds sometimes folks that have an issue with their drinking. It brings it within the regular healthcare setting, and helps to normalize that if you have a problem with drinking, it is a health problem, and there is help within the medical community.
Do you have any closing thoughts for us?
Yes, I wanted to just wish everyone a happy and safe holiday season. I also wanted to address a few of the myths around drinking that are out there, particularly sobering up around drinking. So we know that the average person's liver can process about 1 standard drink per hour. So that means if you have a 6-pack watching the game with friends at a friend's house, it's about 6 hours before you're going to be fully sober. And we also know that a lot of the common solutions that are put out there for helping sober up quicker really don't work. So coffee and other caffeine or other stimulants even really don't help you get sober. They don't reverse the effects of the alcohol. They just rev up your system a little bit more and kind of mask some of the symptoms of being intoxicated. So, telling someone who's intoxicated to just have a cup of coffee or an energy drink and then they should be okay is not okay. Similarly, some folks will say, if someone's looking intoxicated or impaired, cold water on their face or some other stimulus that's not too pleasant, sometimes that will help, and then they'll be okay. And really, there is zero evidence behind that. Those things don't work. It's really just a matter of time in terms of sobering up and letting your body process the alcohol. So with that, I just want to wish, again, everyone a very happy holiday season. Be safe.
Thank you so much for joining us.
Thank you very much for having me.